بسم الله الرحمن الرحيم. الشكر لبوابة البصريات السودانية لإتاحتها لنا هذه الفرصة لتقديم هذه المحاضرة. Yes, our presentation today about amblyopia. As you know, the study of amblyopia is a study of vision deprivations or lack of visions that happening during the childhood. From earlier to current study, it is clear that any deprivations happening during childhood or during early years of life could lead to dramatical change in the visual pathway. And this dramatical change in visual pathway could lead to development of amblyopia. Yes, a result from animals study indicates that deprivations of visions occurring as a result of suturing of lead could lead to dramatical change in anatomical and physiological of the visual pathway, and this could lead to development of amblyopia. If all these conditions happening before the age of 6 years, this could lead to development of amblyopia. Yes, these are our lectures outlined for our presentations. Outline. First, we start by the definitions. Then we move to epidemiology, classifications, ecology, investigations. Yes, in these lectures, we're covering these 5 subject sections, and in the next lectures, we will covering sequential management protocol for amblyopia. This presentation have a 2 parts. Yes, in the first part, we're covering the 5 subsections, and in next lectures, we're covering the sequential management protocol for amblyopia. Yes, first we start by the definitions of amblyopia. As you know, amblyopia is unilateral or bilateral conditions in which best corrected visual acuity less than 6.6 in absence of any structure or pathological change. There is no structure or pathological change of the eye, but the vision not improve after the patient wearing contact lens or wearing a spectacle to 6.6. And maybe there is some problem happening before the age of 6 years that could lead to development of the amblyopia. For example, here, if this patient has uncorrected refractive error, this uncorrected refractive error lead to formations of a retinal image or not formation of retinal image on the fovea, and this eye not send image through the visual pathway to the brain. And this is a normal eye formed the image on the fovea, and this the fovea send the signal to through the visual pathway to the brain. And the brain mainly focus on the image coming from normal eye and ignore the image from the amblyopic eye. This could lead to development of amblyopia in the eye with high uncorrected refractive error or with any problem that affect formations of retinal image. If anisotropia happening before age of 6 years, this could lead to development of amblyopia. And also, if a constant unilateral esotropia or exotropia happening before the age of 6 years, and also could lead to development of amblyopia. Because before 6 years, this period called the critical period. There is any problem happening during this period could lead to serious effect on the visions. And also bilateral asymmetropic. If bilateral uncorrected refractive error of the both eye could lead to development of amblyopia due to failure of retinal image in the both eye. And also unilateral or bilateral astigmatism. Unilateral or bilateral astigmatism also, if uncorrected, could lead to development of amblyopia. And also image degradations, any form that any problem that reduce the quality of the image that form it on the fovea, could lead to development of amblyopia. Any problem happening before the age of 6 years affect the formations of retinal image during this critical period could lead to development of amblyopia. Yes, then we move to the epidemiology. As you know, the prevalence of amblyopia is not high as the prevalence of uncorrected refractive error, but the amblyopia have serious effect on the children could lead to development of visual impairment and also could lead to affect the child performance. For that, the study, the problem around the amblyopia is very important. Yes, for example, the prevalence of amblyopia about 4% of populations. It's just 4% of populations. And also the prevalence of amblyopia in developed country or in advanced country, yes, range from 1 to 5%. And also the prevalence of amblyopia among the African children varies. For example, in Sudan, 5.6, in Ethiopia, 9.6, and in South Africa, 9.4. Yes, the prevalence of amblyopia is the difference according to study and sometimes according to definitions of amblyopia and also according to the ethnicity. And also the prevalence of amblyopia is 4 times more common in premature children. Premature children have a high risk for development of amblyopia. And also the prevalence of amblyopia is 6 times more common among delayed development children. And children with the delayed development problem have a high risk for development of amblyopia. And also women who smoke or use drugs or alcohol during the pregnancy have a high risk for development of amblyopia. Yes, classifications of amblyopia. There are many types of amblyopia. For example, first type of amblyopia is the stimulus deprivations amblyopia. From their name, it is a result of lack of vision or result of lack of vision during early years or the result of lack of vision during the early 6 years of age or during this critical period. Any problem affect the formations of retinal image during these early years or during the critical period could lead to development of amblyopia. Stimulus deprivations in amblyopia may be complete or may be partial. If the condition complete prevent light from entering the eye, result in complete stimulus deprivations in amblyopia. If the condition partially prevent the light from reaching the retina, could be a result of partial stimulus deprivations in amblyopia. This stimulus deprivation in amblyopia may be due to congenital cataract. If the congenital cataract happening before the age of 6 years could lead to development of stimulus deprivations in amblyopia. And also if there is any form of the corneal opacity also could lead to development of stimulus deprivations in amblyopia. And also the severe ptosis, could lead to development of stimulus deprivations in amblyopia. The second type of amblyopia is anisotropic amblyopia. An isometropic amblyopia, if there is any different refractive loss between two eye, result in development of amblyopia. And development of an isometropic amblyopia is the difference according to the type of refractive error. More commonly happen in the patients with the hypermetropic. Patients with the hypermetropic have a high risk for development of an isometropic amblyopia. And patients with myopia have a moderate or have less risk for development of amblyopia, and patients with astigmatism have a moderate risk for development of anisometropia. Commonly, commonly amblyopia develop for the patients who have anisometropic hypermetropia. Yes, ametropic refractive error. If the high uncorrected refractive error, this high uncorrected refractive error began or start during the first years of life, could lead to development of amblyopia. This is due to the effect of the Blair retinal image. The effect of Blair retinal image could lead to development of amblyopia. And also meridian amblyopia. This meridian amblyopia from name, it is a come from uncorrected astigmatism. If there is uncorrected astigmatism unilateral or bilateral could lead to development of amblyopia. And the patients with the oblique astigmatism have a high risk for development of amblyopia. Yes, and also the strabismus amblyopia. This type of amblyopia result of sensory adaptations of amblyopia. Any amblyopia happening in the early years, the visual system start to develop a sensory adaptations for the strabismus. This sensory adaptation to prevent or to treat the diplopia. The sensory adaptation could be binocular sensory adaptations or monocular sensory adaptations. Yes, the binocular sensory adaptations such as suppressions of abnormal retinal correspondence, and monocular sensor adaptations such as amblyopia or eccentric fixation. This is commonly happening in the patient with unilateral strabismus. The strabismus amblyopia is developed after sensor adaptations of the strabismus. For example, if the child have any type of, for example, if I have the esotropia, this esotropia, if happening before the age of 6 years, could lead to development of amblyopia, and also exotropia, if happening before the age of 6 years, could lead to development of amblyopia. This due to unilateral strabismus with onset on childhood. Any unilateral strabismus start on the childhood could lead to development of amblyopia. And commonly, these conditions happen in the patients with esotropia, and less common in the patients with exotropia. Yes, and then we move to ecology of amblyopia. Amblyopia is caused by inadequate stimulus of visual stimulus during the critical period of visual development or early childhood. Any problem happening during early childhood or before the age of 6 years could lead to development of amblyopia, because this is a critical period. Any problem happening during this critical period have a serious effect on formations of the visions or formations of amblyopia for the patients. Yes, several other reports that the change were found in visual cortex area V1 and V2 with the loss of binocular derivance. This study of amblyopia. And also there's other theory for development of amblyopia, and other says that abnormal binocular computations. There is abnormal binocular computations between two eyes. For example, if the right eye is the normal and left eye with uncorrected refractive error, there is abnormal computations between the right eye, normal eye, and left eye have amblyopia. These are computations. Normal eye is the take advantage of these computations and result of development of amblyopia in eye with poor visions. A competitive interaction existed between the two eyes during early visual development. Yes, any problem happening during the early years of development could lead to these abnormal competitions between the two eyes. One eye competitive advantage. One eye competitive advantage, this is a normal eye competitive advantage, result in dramatical change in visual pathway of disadvantaged eye or the eye with amblyopia. The eye with the amblyopia become disadvantaged eye. And also, some authors say that the neurons in the visual pathway of disadvantaged eye or amblyopic eye decrease in functions and numbers. As a result of this competition, this abnormal competition between two eyes result in decrease of neurons in numbers and functions of amblyopic eye. And the pathway from advantaged eye gradually gain more synapse. This normal eye take advantage for that. If this abnormal competition is happening before the age of 6 years, could lead to development of amblyopia. Yes, this is a critical period and sensitive period for development. Yes, the critical period is a relatively short period, start from the birth until the age of 3. This is a critical period or dangerous period. Any problem happening during this critical period or dangerous period could lead to serious effect on the eye. Yes, a sensitive period. Sensitive periods most likely start at the age of the 3 and continues until the 10 years old. This is a sensitive period. The sensitive period also, the visual system have a risk to develop this period. But if there is any problem happening during the sensitive period, have a less effect than the problem happening during the critical period. This is the critical period. Any problem happening during the critical period or dangerous period could lead to serious effect on the formations of could lead serious effect on the eye, or could lead a serious effect to the formations of the eye. Yes, during the sensitive period, the visual system is still at risk to change, but the damage is progressively less. During the sensitive period, the damage have a less effect. The damage with the serious effect that the damage happening during the critical period. Yes, the implants happen later than this period, or later than critical and sensitive period have absence or reduced effect in formations of amblyopia. And also research to predict that human visual development continues throughout at least first decade. Yes, for that, some researchers say that during critical period and sensitive period, this is a period of yes, visual development of the eye. Yes, clinical evidence suggests that the plasticity of visual system remain for period significantly longer than a few first few years or just a first 10 years. Some study indicate that the plasticity or the sensitive period and critical period may be or remain for long period than just a few 10 years after development. For example, the dramatic response for adult patients with anisotropic amblyopia to treatment suggests that residual plasticity remained in visual system for longer than the period than the critical period for development of amblyopia. Some patients with anisotropic amblyopia have a significant development of the visual acuity and response well for treatment of occlusion. This give clues that maybe the sensitive period maybe start or maybe staying longer than just 10 years after the pairs. Yes, investigations, and then we'll move to the investigations of amblyopia. Yes, we start by the sign. Yes, unfortunately, there is no reliable signs to make the patients, parent, or clinicians suspect the presence of amblyopia. The patients with amblyopia maybe come to clinic with a normal eye, the eye without any problem. It is difficult from the signs of the eye to discover the patients with the amblyopia. Just amblyopia is discovered after the examinations of after performing the visual examinations. You can discover the patients with amblyopia. This is a difficulty or this is dangerous for the patients with amblyopia because it is difficult to discover this problem from the signs. The symptoms of amblyopia, the symptoms or a complaint for the patients with amblyopia, complaint of the clear vision, headache, ocular discomfort are potential symptoms that the patients with amblyopia may report. But also, this is very likely that they will no symptoms, or very likely the patient with amblyopia may be without coming without any symptoms. If the patient with the right normal eye have a vision 6/6 and left eye with amblyopia, the patients may not discover or may not have symptoms until you discover this amblyopia during the vision examinations. Yes, also in an investigation, it is very important to assess the refractive error for these patients because any refractive error, any hypermetropic myop or astigmatism that happening before the age of 6 years could lead to development of amblyopia. For that, it is very important during the investigation to assess the refractive error or to assess any type of refractive error with this patient. As we say that the patient with the hypermetropia have a high risk to develop amblyopia. Yes, a fixation characteristic. Yes, this is a very important in examinations or in assessment or in investigation of the patients with the strabismus. It is very important to assess the fixation characteristic. Its fixation is central or eccentric. In almost all cases of anisometropic and isometropic amblyopia, the fixation is unsteady and central. Most of the patients with anisometropic or isometropic amblyopia have central fixation or unsteady central fixation. Yes, central fixation, when we use ophthalmoscope to examine central fixation, you see the visoscope in central in the fovea. But in the patient with unsteady eccentric fixation, sometimes the visoscope become inside the fovea, and sometimes there is slight movement to outside of the fovea or in the parafovea. That the patients with unsteady eccentric fixations. Yes, deep central fixation is the primary characteristic and important differential diagnosis for test for the patient with refractive amblyopia, because most of the patients with central fixation have amblyopia may be due to yes, maybe due to refractive amblyopia, maybe due to anisometropic amblyopia or isometropic amblyopia. This all type is called the refractive amblyopia. And if the eccentric fixation is present during the ophthalmoscopy and in the eye that apparently without any ocular deviations, the eye apparently without any ocular deviations or without any euphoria or exotropia or without any strabism, then the patients may be have a microtropia. For that, yes, eccentric fixation, any patient with eccentric fixation may be, this amblyopia may be due to, yes, strabismus. The patients with the strabismus commonly have eccentric fixations. Yes, suppression characteristic, yes, this anisometropic amblyopia patients have a small relative foveal suppressions area. Most patients with anisometropic amblyopia have a small relative foveal suppression or central suppressions. Yes, a crowding phenomena. Also, crowding phenomena is a very important, yes, a characteristic for the patients or a very important method for differential diagnosis of patients with refractive amblyopia or the patient with strabismic amblyopia. Yes, amblyopia patients maybe have a better visual acuity for single optotype than for later place in the row. Yes, if you examine the visual acuity for the single optotype, the patients may have a better visual acuity than compared to the row. This is a crowding phenomena. The crowding phenomena is commonly in the patients with the amblyopia, and also commonly these are conditions happening in the patient with the strabismus amblyopia. No significant difference in separation difficult between anisometropic amblyopia and normal patients. The patients with amblyopia due to anisometropia have no difficult difficult for separation or difficult for identify single optotype or in row optotype from the normal patients, normal subject. However, the strabismus patient have a significant difference in ability to correct and identify single letter versus crowded letter. For that, the crowding phenomena is a very important differential diagnosis for the patient with refractive amblyopia from the patient with strabismus amblyopia. Yes, the crowding phenomena is a useful method for differential diagnosis for anisometropic amblyopia or isometropic amblyopia from strabismus amblyopia. Yes, the courses and prognosis of the patients with amblyopia. Yes, the severity of amblyopia depends on the following. Yes, age of onset of refractive error. Yes, the age of onset of refractive error. If is this refractive error is happening during the critical period or this refractive error is happening during or start during the sensitive period. If any refractive error happening during the critical period or sensitive period, this patient may become have a poor prognosis. And if this refractive error start after this period, the patient may have a good prognosis. And also the amount of anisometropia, the amount of isometropia or anisometropia or isometropia. Also the amount of this uncorrected refractive error. The patients with the low degree of uncorrected refractive error maybe have a better prognosis. And also the patients with, for example, anisometropic myopia maybe have a better prognosis than the patients with anisometropic hypermetropia. Yes, a change in refractive error during the critical period. If this refractive error change during the critical period, if the refractive error change during the critical period, the patients may have poor prognosis for development or for retain their vision. The prognosis of refractive amblyopia is gradually good for recovery of or improvement of level of the visual acuity. The patients with the refractive amblyopia is generally good for recovery or improved level of vision than the patients with the strabismic anisometropia. The patients with an strabismic anisometropia may be have a poor prognosis to recover their time. Yes, this is the first part of our lecture, and the second in second lecture we start talking about the sequential management protocol for amblyopia. Thank you for the listening.